Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
Hey there. I guess I should say a little bit of background. I'm new to the Concussion Fix program. I started working through the courses. I think I'm almost halfway through. I live in Sacramento, California. Oh boy, I have a list of questions, but I know you can't answer them all right now. I guess one question I have for Dr. Cam is the exercise heart rate band. I know you mentioned that it's good to have one for the chest, but I do have an Apple Watch. Is that okay, or would you recommend purchasing?
No, Apple Watch is fine.
Okay, and then the manual therapy. Right now, I'm currently doing upper cervical chiropractor. Close by where I live. I don't get adjusted every time. He says that basically he's not going to adjust me if things are working and my body's healing itself. And I'm just wondering, is that normal? And also mention not to do any type of massage on the upper neck at the same time. And I'm just wondering if I should listen or if I should do manual therapy because I kind of have the same thing, like on my neck, it's sore whenever it's kind of touched or rubbed. And yeah, I guess I'm just trying to see what I should do about that. Also, originally from Ontario. I moved here to Sacramento, but I guess I'm going home in a few weeks. So if you have anyone over there that you would recommend, in the, I guess, Hamilton, Mississauga area, that's where I'll be. So I'm also open to finding someone there too.
So, I mean, the big issue I generally have with like just the upper cervical chiros is that they focus purely on adjustments and they don't do any of the soft tissue stuff, which is like probably the most important. Like when I see patients, it's more the opposite where it's like I only adjust them, sometimes if there's like something that's like really kind of driving things. Whereas with the soft tissue, it's like a couple minutes of soft tissue work will really clear things up right away. So some people, they swear by upper cervical chiro, but that's generally the people that do really well are the people that only have that issue, right? So if you only have an issue with the upper cervical, then maybe getting upper cervical treatment will be like, whoa, that really helped me. But I feel that's only about 10% of patients, right? Like the other day I was working on a guy and when I pushed on his rhomboids, which are in the between his shoulder blades, that's what recreated his headache. So if he's getting upper cervical work, they're missing the fact that his headache is actually coming from way down here between his shoulder blades, right? So when you stay very, very local, and then not only that, but it's like you can find issues in the hips and pelvis that are causing all these biomechanical alterations that's actually driving the reason why the neck is dysfunctional. So it's just a difference in like theoretical framework. Their philosophy or their idea is that everything is from the upper cervical. If you fix the upper cervical, it fixes everything else below, right? But I find that hard to believe because I would think that starting from the bottom up is going to fix things up the chain, right? Because if your legs are different lengths, for example, because your pelvis is torqued, well, your lumbar spine is going to curve, and then you're going to try and you're going to do anything you can to keep your shoulders and your head level. So if you have this leg length difference, what's going to happen is you're going to tilt to try and compensate for that leg length difference to try and keep your center of gravity in the middle. So adjusting the upper neck isn't going to fix the pelvis below it. It's more the opposite, where fixing the pelvis below it is going to help things up the chain. That's just a difference in philosophy. So I personally think that soft tissue is probably more important than the adjustments, but the adjustments are important as well. And so, I mean, I don't want to go against what your provider's telling you, and that's not what I'm telling you to do, but just, consider that soft tissue is a big issue, and if they're not working on it, you may not be in the right spot. The other thing to consider is, are you seeing major improvements with this treatment?
Um, I don't know. I think it's hard to tell. I've only had one adjustment
Oh,
so
okay.
far. But I did have massages beforehand because I thought that it was more of a muscular thing. It would help in the short term, but then maybe after 2 days, I feel like everything would just come back. And I guess things are getting costly. And I was thinking, you know what? If it's not helping, then I should just stop. But I'm not sure if that was the right
But
mentality.
again, like, massage is generally going to focus on the back of the neck. They're not going to work on other structures in the front for the most part. And it's usually static, like rubbing the muscles, but a lot of times the muscles are kind of stuck to the ones below it. So you have to kind of do it with movement. Go and watch. I did 2 seminars, Manual Therapy 1 and Manual Therapy 2, in my resources. Go and watch those, and you'll see kind of like how things should be treated, or how at least I approach my treatment. And then you can see, okay, is this what I'm getting or not? Because people will say that, be like, oh, I've tried chiro. Okay, that means you've tried one chiro. Different chiros are going to have different, skill sets, different hands, different approaches. So it's trying to find the one that's actually going to do kind of what you need. So I tried to give some examples. I have a video there of me kind of treating somebody, so you can see exactly how I do it. And it doesn't necessarily mean that that's the only way to do it, but you just kind of get an idea of what should be included.
Okay. Thank you so much.
Yeah. When are you coming back to Ontario?
Still don't know the date, but I think in 3 weeks, probably, beginning of March.
Okay. Okay. Yeah, I mean, we have clinics all over here. Would you prefer Hamilton or?
Wherever. Where I would be open wherever.
I mean, we have a good one in Burlington. We have some good ones in like Stony Creek area. So if just, how about you send me a message in the
Okay.
platform, and I can try to link you up with somebody.
Perfect. Thank you so much.
You're
I
welcome.
appreciate it. Do I have time to ask Dr. Hrkal a quick question?
Go for it.
Okay. Uh, so, um, I'm taking some vitamins and I'm just wondering is it possible to take too many at the same time? And I know that you said that it's really hard um, that you haven't seen much success with vegans through the course, but I am vegan and I'm not really open to compromising, I guess that. And so I was wondering, is there anything that I can do to, um, I guess, have the best chance of success being a vegan?
Yes, absolutely.
Okay.
Again, I want to make sure we're clear about that. Is that I'm basing that on my clinical experience, and again, that's if you have an ethical or moral issue, absolutely feel free to do it. So here's the here's the challenge with being vegetarian and specifically vegan. Number one, it's a lot harder to get protein that's bioavailable. It means that that protein is broken down in amino acids, and then that gets incorporated into your muscles. But here's the thing: your brain also uses those amino acids to produce inflammatory cells, neurotransmitters, and a lot of the key building blocks to repair not just brain tissue but also muscle tissue. And we've just talked about how important the neck is. So that's number one. So that number two, there's a lot of trace elements and minerals that are just really hard to find in plant-based sources. So the main ones are zinc, and then iron will be the second ones. And so iron, you can find it in non-animal based sources. However, it's not very absorbable. And this is the big thing that I find when we're having these kind of like discussions online. It's like, oh, you can find iron in dried apricots and spinach. The problem is it's present there, but it's in forms that's so hard for the body to get out, because all the fiber that comes out, that comes with those those foods that are higher in those minerals, they are going to bind up all the minerals and not allow them to be absorbed. So that's another issue. So far we have protein, then we have specifically zinc, which is mainly only found in animal foods, and then we have iron, and then you have the vitamins. So fat soluble vitamins like vitamin A, really the only natural source that you can find is in organ meats, and then vitamin K is mainly found in things like butter. Grass-fed butter is going to be higher in vitamin K. So those are fat-soluble vitamins. So you can supplement with all the things that I've shared so far here. But you have to be a lot more on top of it. There's a couple other ones. Then there's B vitamins, and the B vitamin family, again, is found in small amounts. Certain ones like folic acid is found in specifically vegetables and a couple of fruits like strawberries. But B12 is not found, and it's difficult to find it outside of the animal world. And again, meats and organ meats are going to be the richest sources of B12. And then finally, and probably one of the most important ones when it comes to brain health, is creatine. Creatine now has really enjoyed a resurgence of online attention, where some new research has come out in the last couple of years showing that especially women, as they age, they are going to have decreased levels of creatine, and it has a lot to do not just with muscle formation, which is what it's been studied for the last 3 decades, which is like, oh, creatine, that's like for that person that's like weightlifting in the gym and trying to put on muscle mass. That was the old indications, but the new indications are it's really helpful for brain function. So that's one of those things. If you're not eating any sort of animal meat, which is the place where you're going to get creatine levels, then you're definitely going to have to supplement. So just as a review, B vitamins, the key minerals, so like iron and zinc are really important. So iron specifically is one that you really want to emphasize. Creatine, fat-soluble vitamins, and then in the family of fat-soluble vitamins, there's omega-3s. And omega-3s, you have to find really the most bioavailable sources in fish, and there is some algae sources, but again, it's a lot lower, and you have to dose pretty high to get that. So if you cover those 5 kind of bases, then you can offset the kind of disadvantages of being vegan. Does that make sense?
Yes. So fat-soluble vitamins, iron, B vitamins, and creatine.
Yeah.
Okay.
And then omega-3s as well, and then obviously protein. I started the conversation off with protein, and I should mention that's a pretty big emphasis. So that means that maybe you need to do like a scoop of plant-based protein to kind of up your levels. I find, because I work a lot with people that are trying to optimize their body composition over and above brain health, and it's probably the biggest thing that people don't get enough of. And it's a calculation based on your body mass. So you want to ultimately get, in order to kind of maintain your muscle mass, if you want to build muscle, like hopefully everybody does that's listening to this, then you actually want to get above what your basic needs are. And you're somewhere in the neighborhood of about 1.5 grams of protein per kilogram of your weight. So that's a quick little calculation. So convert your pounds into kilograms and then multiply that by 1.5. And that is how you find your ideal protein intake daily level. And what you'll realize is that for most people, it's somewhere between 80 to 100 grams of protein a day, which if you just break it down, that means it's 30 grams of protein per meal. And something like an egg and yogurt, if you're vegan, you're not doing that, you're going to get maybe 10 grams of protein. So right away, it's a huge obstacle if you're not supplementing, especially if you're 100% vegan and plant-based.
Perfect. And then is it possible to take these supplements too much at the same time, or can I take them all in the morning?
Yeah, that's a great question. So I'd suggest that you try to divide them up as much as possible, especially minerals. You don't want to take them all together because eventually they do compete with each other. B vitamins can all be taken together. Fat-soluble vitamins and omega-3s can all be taken together. And so those are fine. So I think most people, just from a compliance perspective, there's like a morning dose that you can bring all this stuff in. And then there's an evening dose, and maybe just break out the iron and then the creatine by itself in order for it to be optimally absorbed.
Okay. Thank you so much.
You're welcome. That's a great question.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.